Chelsea Boss, Doctor of Physical Therapy, founder of Compleo, back to talk to you today about pelvic floor health during pregnancy and exercise during pregnancy and what's appropriate. So again, this is really individualized, but I'm going to give you just a couple of generic advice. Pelvic floor health is incredibly important during pregnancy and postpartum. People don't realize this, but if you think of our bodies like a little Coke can with our pelvic floor at the bottom and our core and ribs is the vertical part, and even our windpipe opens and closes at the top like the tab. So really everything in the trunk system is connected. So tension in the pelvic floor or pain in the pelvic floor can cause breathing symptoms all the way up the chain in your body. So I really recommend, even if you're not having a lot of pain or traditional symptoms, doing at least one visit with a pelvic floor therapist sometime in the second trimester of your pregnancy to get some education so you can prevent symptoms, so that you can prepare for childbirth, taking care of your pelvic floor. What a lot of people don't realize is a lot of pelvic floor symptoms come from overactive pelvic floor muscles and not knowing how to relax those muscles. And if we're going to have a child in natural childbirth, we have to relax the muscles so the child can come out. And then a lot of times we're just online seeing exercises that are all about strengthening, and we could be contributing to that. So the strengthening and relaxing is important. So that's where a pelvic floor therapist can guide you through what types of exercises you specifically need. And then postpartum, taking care of your pelvic floor is just as important to make sure. We usually wait till about 6 weeks postpartum to start to look at care for those pelvic floor muscles. Then for exercise in general, pre and postpartum, that is also individualized. You need to listen to your body, but you don't need to lay in bed all day like old advice says. And so general rule of thumb is if you were doing it before pregnancy, you can keep doing it. Research is showing how important exercise is and loading our muscles is. So if a lot of times women take pregnancy as an opportunity to really start taking care of their bodies so they can nurture that growing body. So then you just want to gradually work up exercise. You don't want to jump into something at a high level if you haven't been doing that pre-pregnancy. You want to work with a perinatal trained trainer or physical therapist to gradually increase your level of exercise. But exercise and taking care of your pelvic floor is very important from as soon as you know you're pregnant, and you can partner with some people to talk with you about your goals and your needs and make a plan for you.